Telecom Ultrascan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the lower jaw. On the panoramic view, you can very clearly see that there is an edentulous space in the anterior and the lower right side, and we've got canine, two premolars, and no molars on the lower left side. Now we've got the anterior ridge is quite significantly thinned out. We're going to show you over here. So we've got a very thinned out anterior ridge, knife edge, especially where the teeth are. As you can see, the teeth are floating outside, and this has led to atrophy of the ridge. We've got limited bone around the premolars. So the lower left side has much limited bone than the lower right side. The lower right side has adequate bone, and we went ahead and placed implants. You'll see the implant sizes as well. This is what we've done. So we've placed, so because we don't have DTI in our system, because they haven't uploaded an implant library to the company, we've gone ahead and made a similar implant brand which is has the same sizes as DTI. So the yellow implants are 4 in the distal most implants are 5 in diameter. The yellow implants on the mesial surfaces are basically 4, and the green ones are 3.5. You get a implant planning report so that you can see. So the lower right side can support 4 implants, and the lower left side can support 3 implants, and this way with 7 implants the patient can actually get a very well supported implant supported prosthesis. If you look at the axial view, which is the top to bottom view, you will be able to appreciate that all the implants are quite center of the ridge, right? So this is how the placement is going to be done if the implants are supposed to be planned. We will send the report along so that the doctor can also visualize. Now the distal most implant on the lower right side, we've got approximately 10 millimeters of ridge width with 7.3 millimeters of height. So this is why we placed a 5.7. Moving to the region of the 5, we've got approximately 6 millimeters of ridge width with approximately 11. So we've placed a 410 implant here. The canine region, we've got in the canine region, we've got approximately a 6 millimeters of ridge width with approximately 10 millimeters of height. In the anterior region, we've got approximately 4.6 millimeters of ridge width with 12 millimeters of ridge height. Moving to the lower left side, this is the implant which is between canine and first premolar. Here we've got approximately 6 millimeters of ridge width with approximately 11 millimeters of ridge height. And we've got, so here you'll have to place the implant much deeper, approximately 4 millimeters deeper to get a good adequate bone, 5 millimeters of width with 10 millimeters of height. And then moving on to the distal aspect, the way we've got very good bone. So we've got approximately 5 millimeters of width with approximately 10 millimeters of height. So this part here is not the mental foramen, but this could be a vascular bundle. So we would not advise drilling through this. We'd advise staying superficial to this. Thank you very much.